Awesome, awesome, awesome. I like your hair like that.
Oh, thanks. Allie and I had a Halloween day today, so you can't tell, but I'm actually in costume.
Ooh, what are you doing today? What are you supposed to be?
I am a happiness fairy,
All
so I took off
right.
my wings.
I mean, but technically that's true though, because you make people happy.
Right? So
I
I
mean, it's pretty
try, I
accurate.
try.
Pretty accurate. Awesome. So I wanted to jump on here, especially after I know we talked about this before, but especially after I saw that blog post that my friend did and Dr. Keneal Siegel. And I was like, yes, let me call Chelsea and let's get this going because, I mean, oftentimes a lot of people think, well, I've got to choose one or the other. I need a PT, but wait, I might need a chiro. Wait, who do I go to? And they don't know. And it's not like you have to choose one over the other. So I just wanted you to talk a little bit about what you do, how you help, especially moms, pregnant and postpartum, where people can find you. So, just go ahead and give everybody a brief introduction to who you are. And let me silence these
Awesome.
devices.
Hey, it's part of the life, right? So, hey everybody, I'm Dr. Drda. I'm a chiropractor at Atlanta Natural Health Clinic in Chamblee, which is in Northeast Atlanta, and I am certified in the Webster technique, which is a special chiropractic technique for pregnancy. And I'm just one of many providers in Atlanta who provide exemplary pregnancy care and before you're pregnant and in the postpartum period and beyond. So Jay, you asked about why it's so important to have a balance between chiropractic and PT, right? Everybody thinks that, yeah, exactly that. I need to have one or I need to have the other. And one of the things we were discussing over that article is just the fact that chiropractic and physical therapy melt together so beautifully.
Yes, they do.
So beautifully, especially surrounding pregnancy, because we have relaxin in our systems, right? The second we get pregnant, that relaxin starts kicking in and everything comes apart, which is great. And it's bad all at the same time, right? I know you see this as much as I do. And we have so many changes to the pelvis during pregnancy. The biggest issue I see is that I've yet to see a new patient who didn't have their tailbone being stuck. I actually brought my handy dandy pelvis with me today. For those who don't know, this is your pelvic girdle. These are the big bones of your hip that we think of, right? And there's your tailbone right in the middle. We sit right here all day long, right? And that repetitive trauma to your tailbone just of sitting alone, let alone if you've ever fallen down the stairs or like me, fallen on the ice or fallen roller skating.
Or all the above.
Things, all of the above, right? I've definitely fallen all of the above. All of those cause your tailbone to get out of alignment, right? And when your tailbone's out of alignment, it's not able to do that nutation, that figure 8 motion that it does every time you take 2 steps, and it will drag that side of your pelvis down and create distortion. Now, the reason this becomes even more important during pregnancy is because it changes, first of all, the alignment of your pelvis, right? Second of all, how the ligaments and the muscles are able to support your uterus. So it affects baby's growth, amount of space available for baby. And then thirdly, the shape and size of the pelvic outlet. You need to fit your baby's head out of the bottom, right? You need to be able to get out of the outlet. If you have a decrease in size, Williams Obstetrics, one of the biggest textbooks for obstetric care, for pregnancy care, states that any contracture, any decrease in the size of that pelvic diameter causes difficulty during labor. I mean, this is a no-brainer. I mean, and that's not even considering pain, right?
Right.
So
and
one of the
really
things
need that to happen because then you think about the things that happen, like women having to have a C-section because they can't open enough, because they can't dilate enough, because there's no room that for that baby to pass through.
Absolutely, absolutely, or just stalling the labor and having that time clock run out. Yeah, it's a real problem. And so, of course, and I'm sure you can elaborate on it. It would be great to have you elaborate on how that distortion affects the pelvic floor.
Mm-hmm. Well, and that's a great segue too, because oftentimes if we're not in ideal alignment, then it changes the position of the muscles. The muscles are usually attached at, some point of origin and some point of insertion. And not to make this too complex for those who may be watching, but you've got two anchors, and that's kind of what stabilizes the muscle, and then the muscle can move from there. So obviously you would think there has to be an ideal position. And we can function within many positions, some better than others. But if you think of the fact that if now you're in poor alignment because your tailbone is stuck, or you've got pelvic issues, pelvic alignment issues, you've already got so many postural changes happening when you're pregnant because of the size of the baby keeps growing, the size of your breasts, which also keep growing, and that's kind of pulling you forward, your center of gravity is changing, things of that sort. Now you think, well, some of these pelvic floor muscles, because of all these changes, aren't in necessarily their ideal position, the positions that they would need to be in to work as well as they could. And so with that, you either have really overworked muscles, so they end up getting really, really tight, and some women can get a lot of pain from that, or they're put in an overstretched position, so now they become even weaker. And like we always say, a really tight muscle or a really stretched muscle is not a strong muscle. Those muscles aren't going to function the way that they're intended, and then that can cause a lot of the problems that we see, whether it be leaking, the pelvic pain, and so on, that a lot of women will have.
Absolutely. And I think another thing that a lot of moms don't know is that if you're breastfeeding, that relaxin stays in your system for up to 9 months after you stop. Mm-hmm. So that has an impact on the pelvic floor as well, right? Because It's still allowing those muscles to relax. Your pelvic girdle is still not stable. Mm-hmm. And so we can see these symptoms show up sometimes even years after the fact.
Mm-hmm. Yeah, the relaxin and the estrogen, because the estrogen levels mm-hmm. are still high, and the estrogen, the research has shown that that's been, kind of a contributor as well to some of the laxity that you get. And again, for anybody that's listening to this, we don't want you to think that all of a sudden your pelvis just melts and falls apart. I try to talk to patients in a way that I'm not scaring them. But what we do want you to realize is when your baby is growing, it has to have a way out. And it was God's design to have your body be able to function in a particular way, which is the level of the hormones, the relaxin and so on, will elevate because they tend to soften the ligaments. The ligaments are what holds the bones together and what help to create the joints. So they help to relax the ligaments, and with the ligaments being relaxed, those joints can come apart more easily and are more flexible to allow for that baby to pass through. The problem comes in where you've got all that laxity and not enough stability, because you still need to be somewhat stable. And a lot of women, if they've had prior injuries or other issues that have occurred, then they tend to have some problems with that.
Exactly. And, the bottom line is that we're living a very different life today than the way God designed our bodies, right? We were designed to be mobile people. Women in the United States in particular bend over instead of squatting down, right? Because we're in a skirt or we're wearing high heels. Yeah. And that also creates a dysfunction there, right? That changes the whole dynamic. Or better yet, in the postpartum period, we're doing a lot of work in addition to around the house or in our jobs, in addition to holding our babies, and we'll hold them on a hip. Mm-hmm. And that again contributes to that dysfunction. So mm-hmm. yes, of course, we're not trying to say this to scare anybody, but just to be aware that we're all doing these things. And that's why it's so important to get evaluated before your pregnancy, or certainly once you find out that you're pregnant, and be proactive about it. Make sure that you're taking care of yourself sooner rather than later.
Absolutely. Now, for all those listening, tell us a little bit about what Webster technique actually is. I'm pretty sure a lot of women have heard about it, and they're like, so they're going to do what when I'm pregnant? Yes. So go ahead and tell us a little bit about what that is and why it's beneficial.
Sure. So the Webster technique was developed by Dr. Larry Webster, who's the founder of the International Chiropractic Pediatric Association. And it's a very well-researched technique. It's actually one of the best research techniques in chiropractic. And there's a growing volume of research surrounding that. But the intention is to decrease or eliminate any misalignment of that sacral bone, of that tailbone, to make sure that it's free moving and in a proper alignment in the pelvis, okay? And the intention of that is to make sure that A, you have mobility, and B, there isn't that torsion of the supporting muscles and ligaments of the uterus. So your baby has enough space to grow and enough space to move on its own in order to get into appropriate positions, in order to flip head down, just having some day-to-day movement. And I think a lot of women don't realize that your baby does rotate even during the birth process. You know, the baby has to rotate in one direction to get into the pelvis and then rotate further to come out, right? And this is something that one of my midwife friends talks a lot about. So the Webster technique can be performed with a variety of different chiropractic techniques. There's not one specific type of adjustment. So like a hand adjustment versus an instrument adjustment versus a drop adjustment. That depends on the practitioner, but it's a system of analysis related to that. So moms, I would encourage you to speak with your provider, speak with your chiropractor or a chiropractor that you're interviewing, and ask them about their personal technique and what, you know, and see if that's the right fit for you. A lot of chiropractors will do a consultation with you before you have to establish care with them. Find someone that you're comfortable with. You know, there's no right doctor for everybody. I'm sure, Jay, you probably have clients that you say, no, I'm sorry, we're not the right fit. It is important to trust your provider. So having that knowledge is so important.
Oh, absolutely. Absolutely. Because at the end of the day, our job is to help the client. You know, that's who we're here to help. And we want to give them the best care. And like I tell people all the time, if I don't know, I'm going to find somebody who does for you. You know, we need to be able to, and that's the beauty in community, even in a clinical setting, because, you know, all of us have our strengths, all of us have our knowledge base, and we can do so much for these patients. Now, is the Webster technique always performed in the prone or lying down on your stomach position?
No, it depends on the practitioner and what kind of work that they're doing. But for moms who don't know, chiropractors who do have you laying on your stomach, like patients in my office get adjusted with a drop or an instrument adjustment, which means they are lying on their tummy. I have special pillows that keep your belly away from the table. So even though you're laying face down, your belly is totally protected. There's absolutely no impulse or impact on your belly. Your belly is totally secure, and we're going to make sure that you're nice and comfortable.
Awesome. And how often, how often are people coming for treatment? What's a typical, if I'm a pregnant mom and, you know, I decided, let me follow up with chiropractic care, how long is there a typical length or number of treatment sessions that you guys recommend? Is it, you know, let's go ahead and treat you today, kind of see where you are with regards to your pain or whatever issue and complaint you're having, and then follow up from there? What kind of system do you guys use?
Sure. So I would say treatment plans are very subjective, and I'm sure you see this with your clients as well. It really has so much to do with the mom's previous history, you know, whether she's had pelvic pain before, whether she's had a lot of serious falls, or she's had a lot of car accidents, or she does for sure sit all day. You know, how much personal stress she has in her life, because your personal stress, your emotional stress also has an impact on how your body handles physical stress, right? And so that definitely has an impact on it. I would say in general, it also depends on how early in their pregnancy they're starting with me. I've had moms come to see me anywhere from once a month to twice a week, just depending on what they're dealing with. But usually once they establish care with me, they will continue through their pregnancy, just because they're overstressed, and the adjustments help them manage their stress in addition to helping balance their pelvis. But I do have a piece of data for you. A study done in the Journal of Midwifery and Women's Health in 2006 showed that 94% of women had clinically significant improvement in their lower back pain on average within 2 visits or 5 days length of treatment in between. So it really, again, it's very subjective. I would ask you the same thing about pelvic floor therapy.
Absolutely. So, you know, it's that beautiful phrase, it depends. It depends on what the moms are coming in with when they're pregnant. I typically will see most moms once a week. But oftentimes if they're pregnant, it just depends on what they're coming to me for. You know, is their complaint primarily pain? Is it they're coming in with leaking? A lot of the times, some moms just come in because they want to do some strengthening. They, they're like, I'm starting to feel kind of out of whack. I just kind of need something. And so oftentimes I can see them as often as once a week, or I might stretch that out every other week. And depending on the mom, and if they're able to manage their care well, we can do once a month as well. Oftentimes with the moms, when they come to see me, or rather when I go to see them, because I do home visits, it's a lot of postural assessment, movement assessment. And I love going into the homes because I get to see what you're doing on a day-to-day business. I can't necessarily, I can hear it. I can kind of, get an idea of it if you come into a clinic. But when I go into the home, I can see how you're dealing with your other kids. Because, sometimes I think we forget that moms have other little ones running around at home. So I get to see how you do, what you're doing with them. How are you doing with your normal activities of daily life? Taking care of your home, preparing meals, doing the laundry, lifting stuff in the house, what are you doing all day? Are you sitting all day? Are you laying down? That kind of stuff. And being able to just, based on what their needs are and where they're at in their pregnancy, kind of give them a comprehensive assessment. And then from there, we can scale their visits. I've also had some moms that it might just be, I'm having this pain. I go ahead, I do some hands-on work with them. And then, it may be as simple as, let's go ahead and get you in a brace. And we do the brace and they're like, what? I feel so much better, at least when they're doing their activity. So it may be 1 to 2 sessions, it just depends on that mom and what their needs are.
Yeah. And absolutely. And I love that you brought up bracing, because I feel like a lot of moms are really hesitant about bracing, or they feel like it's going to be uncomfortable. Let me tell you, all of the people I've ever worked with who've required bracing are so relieved when they make that change, just having that extra support. Because again, you and I are both making corrective changes to the body, and she's also making corrective changes on her own with the exercises you give her and the things that she's doing at home. But at the same time, we are working with that relaxin, and sometimes the relaxin works faster than we can, right? So that's where that becomes such a wonderful support system.
Yeah, absolutely. And the other thing too to mention, great compliment, because even with, and I know as PTs, we tend to do mobilization, joint mobilization as well, whether it be in the pelvis, the lower back, the sacrum, the coccyx. We tend to do a lot of mobilizations, whether it be just a mobilization bone on bone, or whether we're doing muscle energy type techniques. That's another type of technique that we tend to do, where we just kind of do the mobilization along with the person doing some type of activity. But one of the things that's so important too, especially even when they're working with chiros, and one of the reasons why I think PT and chiro are such a great complement, is because of that relaxin, we don't get the form closure that we need for the pelvis, especially at the sacrum. And with those SI joints, oftentimes, we don't get that. And people are still having pain. They're having SI joint pain. They're having that lower back pain. And so now we have to rely on the ligaments, the tendons, the muscles to strengthen. And that's a huge component of why strengthening. I'm such a huge proponent of strengthening during pregnancy and exercise during pregnancy, because those muscles get to help with creating that stability that you need during that time. And so if you're getting the right positioning, which is where chiro especially comes in, if you're getting that positioning, then we can definitely follow up and say, okay, great. Now let's get everything stabilized. We've got you where we need you. Let's go ahead and stabilize everything and get you to be able to maintain that really well, and in addition to the bracing and other things of that sort. So I think that's awesome.
Exactly. And I completely agree about strengthening. It is absolutely vital, because like you said, we're working against that relaxin, and we want to be able to stabilize that pelvis, not only during the pregnancy for pain treatment, but also, of course, during the birth. We forget about what's necessary for those muscles to be strong during birth. And then, of course, in the postpartum period, when she's not thinking about herself as much, she's really focused on the baby. I had a mom tell me the other day, I just can't think about my body right now because I'm so tired. And that's just the reality of new mom life. And again, that's just part of the beauty of that journey, finding the strength within yourself and knowing, yes, I was able to do this. But just kind of piggybacking on what you were saying about the mobilization and stability of the pelvis. Another thing that people forget about is the neurology.
Yes.
Another big thing that chiropractic deals with is actually that neurological balance. And we want to make sure, we live in this world in 2018 where moms are going, I'm here, I'm there, I'm everywhere, I'm doing 800 different things. Like you mentioned, the activities in the home with the other children. I mean, she is always go, 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 go. And the brain makes that think that we're running away from a tiger, right? And we get into this stress-driven environment. Babies don't come when there is stress in the body, right? The body needs to be able to relax in order for that birth process to really happen. And so one of the benefits of the adjustment is removing some of that interference from the nervous and restore to come into play, which is so important both for the baby's development and birth.
All right. I hope I didn't lose you there. Okay, there we go.
Still here.
Okay, yeah, I had a little bit of interference on my end, but I mean, and that's huge because a lot of moms, a lot of people in general just don't relax. We've got baby on the hip while we're like cooking the food, while we've got the cell phone, while we're screaming at the other baby, while we've got like the dog running around the house and trying to like tell the husband what to do. And it's like constant chaos for a lot of moms. And so, learning how to relax and learning how to just calm down and decompress that nervous system is huge.
Huge. And I tell moms all the time, and this is even true for first-time moms or prospective moms, you have to make time for yourself. I actually recorded a video for my Facebook page about that today. Like, you have to make time for yourself. You are your first priority, especially during pregnancy, knowing that postpartum period is more about your baby. Take the time for yourself now. Mm-hmm. It is vital. And you have time.
Absolutely. Yeah. That's huge. That was something I learned by the time the second baby came around, but definitely not when the first one was here. Because I always felt so guilty, as a lot of moms. It was like, well, I can't do this. Well, you know what? No, I need to be with the baby. And it's hard. It's hard. Mm-hmm. And it's something that I know a lot of moms, I know I've struggled with it. I know I've spoken to a lot of other moms who struggle with it, but you're so right, because, if you don't take care of you, then you can't adequately take care of somebody else, mm-hmm. And it's as tough as it is to say, it's so true. Yep. Now, what about, oh, go ahead.
No, I would add that not only can we not take care of people under those circumstances, take care of our kids, help our husband, but I think they get better parts of us when we give ourselves that self-care first, right? Yeah. That was just saying that.
Yeah, that is very true. That is very true. Now, what about as far as after pregnancy? What does your typical after pregnancy care look like? What are you looking for with these moms?
Mm-hmm. So pelvic pain is a big red flag to me after birth, because again, we're decreasing the pressure in the pelvis. That baby has made its way into the world. If they have pelvic pain, for me, I'm paying very close attention to that, because often if they haven't seen a pelvic floor therapist, that is immediately when they get that referral. That's first and foremost. A lot of the moms I generally see for wellness. So it's mostly just making sure that she is still taking care of herself and helping her decrease her stress in the postpartum period. That's most of the moms I see. How about for you?
Same. A lot of the times, moms are coming in for a variety of different things, mostly pelvic pain, or back pain. Or back pain. There's a lot of back pain. Mm-hmm. Diastasis rectus abdominis, pain with intercourse. I mean, leaking. There's a long list. But typically, it's just trying to be able to first and foremost educate the moms. Oftentimes, I think people tend to freak out. Something's wrong, and they're like, So it's trying to get them to kind of calm down, educate them. Here's what's going on. However, here's what we can do to remedy that, and just get them on a course and a program to address those issues, whether it be diastasis, whether it be their leaking, whether it be their pain, and getting them back to the things they love. I actually had the pleasure of working with a mom. She was so amazing. She's a mom of multiples. And like we were talking about before, she was saying, I felt so bad. I feel so guilty because to go spend money and, like, even if I'm in pain, like my kids need me and I'm sure there's something they need. And I'm like, you know what? It's okay. Let's get you fixed first so you can give the best mom care that you can to them.
Mm-hmm.
And she was having back pain. And so a lot of it was education because, we talked about her diastasis, which had decreased some since birth, but she was a couple years out. And so we worked on that. We talked about education. We talked about functional versus cosmetic, because I think a lot of people tend to get caught up in the whole, well, I need to look like what I looked like prior to pregnancy. And that may or may not happen. There is beauty in every phase of your life. There is absolute beauty. And, I often will tell moms a lot of times, we need to start by loving ourselves first. But we taught, we did a lot of education. We looked at her posture, her breathing, movement, all types of things, and then got her back to a program within 4 visits of being able to work out. She was having no more pain. She was able to go to the park with her kids. She was like, well, I want to start back a fitness program. And I was like, great, let's do it. And so we got her on a program, and, things like that, it makes me so happy because I'm like, God, I love helping people. I love what I do, because here was a mom who came to me and she was like the first day I saw her, she can't go 5 minutes without crying because she's hurting so bad. And then she's feeling guilty because now she's got to, get help, which is taking time away from her kids. So now she's crying about that too. And it just broke my heart. Awesome, awesome lady.
No, that's such a beautiful story, because I tell you, I think women don't even realize how much they're dragged in healthcare rather than led or guided in themselves. So it's so important that they have resources like you where they can say, yes, absolutely, I know that I can take care of myself. Like, I feel guilty, but I know that if I am under care, I'm taking better care of myself. I'm taking better care of my kids. Mm-hmm. And I want to reflect back on what you just said about how there is beauty at every stage in your life. I think that's something we need to shout all across the globe. And I have seen some pictures on Instagram of moms posting their post-baby bellies and being so proud of it. And I love that. And not that there's anything wrong with wanting to look back the way you did before your pregnancy either, but loving yourself where you're at, I absolutely agree, is priority number 1.
Mm-hmm. And with that too, a big education tip and a big point that I try to make is, it took 9 months to make this baby. We baked for 9 months. We're not just automatically, it's like when you bake in the oven, you kind of preheat the oven, you bake whatever you bake. You got to give that oven time. Even when you turn that oven off, that oven is still hot. It takes time for that oven to cool right back down. You go put your hand in there, you're going to get burned. Just like that, it takes time after childbirth for our bodies to kind of come back, reconnect, to just, get back to where we were and to heal. And healing is huge. It doesn't happen just like this. We've got to give our bodies time to heal. We've got to allow our bodies time to heal. And that for some women is going to be longer than for others. It depends on the amount of trauma that you've had. It depends on, if you had a C-section or not. It depends on if you had an episiotomy or not. If you had a big baby versus a little baby. If you had a lot of stress during that pregnancy, during that birth, even after that birth. So there's so many factors that go into it. And I think that oftentimes a lot of moms forget that. It's like, okay, I need to be back to normal now, the day after having a baby. And it's like, no, we need to love on ourselves a little bit.
Absolutely. I'm so glad you mentioned that, because that's, I think, where we go wrong in all aspects of healthcare, right? Is forgetting that healing requires time, because just like you said, it didn't happen overnight. Even the people we see with injuries, there was usually some injury to that tissue before, whether that be emotional stress, repetitive physical stress. I mean, something happened. It's not like, it's very infrequent that we just see, oh, I had this injury and it came out of nowhere. Right. But otherwise, it did require time, and then it takes time to go through the healing process. And in our world where, again, we're go, 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 and we have access to the drive-through and instant gratification on our cell phones, it requires even more focus on our part.
Yeah. Absolutely. I'm so glad we did this. I just
Me
love
too.
talking to you all the time because you're such a wealth of knowledge. You're such an amazing person, and and it shows you absolutely love what you do, and just your caring personality. I mean, it's amazing. So if people want to reach out to you, if people want to get in touch with you, how would they do that?
Oh, first of all, thank you so much. I feel the same time same way every time we talk. I learn something new. I'm like, yes, I really needed to know that. And there's such a world, right? And again, this is why you want your providers working together. You want to be working with a chiropractor and a physical therapist because we both have our specialties, and there's so much knowledge there that we all bring to the table, right? So you are just giving yourself the best gift when you choose cooperative care.
Absolutely.
If you'd like to reach out to me, you can find us on Facebook or Instagram at Atlanta Natural Health, or facebook.com/Atlanta Natural Health, or www.atlantanaturalhealth.com. Try to make it pretty easy.
Awesome, awesome, awesome. And I'll be posting all of that information when I post this video. But again, it was so, so awesome talking to you. And I really appreciate you taking the time out to just, do this. Because I feel, again, like women just don't know. And you can go on Dr. Google, who's well known for its amazing ability to give diagnoses. But, you can go on Dr. Google and, it's like, well, where do I go now? Because it's just like information vomit. And so it's good to be able to team up with other clinicians and say, hey, if this is what you wanted to know, here's a person you need to go to. This is the perfect person for you. So, I really love that collaborative effort. But thank you so much again, Miss Chelsea.
Thank you. I appreciate it so much. This is the best conversation, and I'm glad we were able to empower moms about this.
Absolutely, absolutely.